This is an RNZ podcast.
Auckland surgeons are sounding the alarm over a new equity index-based waiting list that critics are labelling divisive. The new system uses 5 categories to place patients on a medical wait list, including clinical priority, time spent waiting, location and deprivation level. But it's the 5th category, ethnicity, that's raised concerns.
That was News Talk ZB News kicking off at 5 a.m. on Monday, and those clinical concerns among unnamed Auckland surgeons quickly kicked on to become a national issue right across the media, and a big political debate also about so-called race-based healthcare. Now, the story was based on a scoop from News Talk ZB's political journalists, Jason Walls and Barry Soper, and it led the ZB News bulletins all day on Monday. And it also filled the front page of its stablemate, the New Zealand Herald, the same day, under the heading,
Surgeons express unease at new scoring tool, describing it as ethically challenging.
That tool being the Equity Adjuster Score, which aims to reduce inequity in the health system by prioritising patients according to a balance of those 5 factors that you heard there in News Talk ZB's 5am news. But moments after that, the host of ZB's early edition show, Kate Hawkesby, told her listeners this.
Auckland surgeons are now being dictated to on ethnicity grounds over who should get surgery first. Māori and Pacific Islanders waiting for surgery, they're being moved to the top of the very lengthy hospital waiting lists.
Now there, Kate Hawkesby was echoing the news story on the News Talk ZB website, which was headlined like this.
Auckland surgeons are being dictated to on ethnicity grounds over who should go under the knife first.
Though later, that was changed to Auckland surgeons must now consider ethnicity in prioritising patients for operations, because the Equity Adjuster Score doesn't move people to the top of waiting lists on ethnicity alone, or dictate to surgeons for that matter. Now, the story went on to say that some surgeons, who spoke on condition of anonymity, said that the new scoring tool was medically indefensible, and one told the Herald this.
There's no place for elitism in medicine, and the medical fraternity in this country is disturbed by these developments.
Though quite what elitism the surgeon was worried about there wasn't made clear. And on ZB's early edition show, Kate Hawkesby then went on to tell the listeners this about how the story came about in the first place.
Barry Soper did the story for ZB, and he contacted the Te Whatu Ora business support manager, a guy called Daniel Hayes, and he claimed he didn't know, he'd never heard of ZB or Barry, or didn't. I think he thought the whole thing was a prank and he didn't want to talk about it. But he was the one who sent an email saying, hey team, heads up, this is a new criteria, that you'll be, lining up your patients accordingly. So basically telling them Māori and Pacific patients first, kei ngā mihi. And anyway, he didn't want to talk about it when they approached him.
Now, that email from the Te Whatu Ora staffer, as reported by the New Zealand Herald, did inform colleagues about new criteria for patients, but it didn't say they'd be lining up Māori and Pacific patients first, as Kate Hawkesby said there. Now, the story in the Herald did also seek to explain why the Equity Adjuster Score was being deployed in the first place. It quoted the Health Minister, Aisha Verrall, Sir Colin Tukoitonga, a leading expert in Pacifica Health, and Te Whatu Ora's Dr Mike Shepherd, who told ZB the inequity was complicated and required a sophisticated solution. And
it's important to note that ethnicity is not the only element considered in the scoring system.
And at the end of Kate Hawkesby's early edition show, General Practice New Zealand Chair Dr Brian Betty told Kate Hawkesby,
we've seen this in other areas, for instance, immunisations for flu vax. Māori and Pacifica are given access to immunisations at a younger age because they have worse outcomes at a younger age. In New Zealand, all the data backs that up.
But before they'd heard context like that, early risers listening to ZB and hearing about Māori and Pacifica patients getting to the front of the surgery queue were firing off angry text messages to Kate Hawkesby like this.
Kate, the person who leaked the medical apartheid should get a medal. What else is this racist government hiding in all areas? Kate, I registered as Māori with the health system, even though I'm not. No questions asked. If you can't beat them, join them. Kate, outrageous that New Zealand Health's now prioritised for Māori ahead of urgent need. Preposterous to have an apartheid system based on race. Surely this is New Zealand democracy's dismantled. Absolutely disgusting, Kate. Those who need it the most should be at the top of the list, regardless of what colour their skin is. Decision made. I'll now definitely vote now. International. Kate, I have bone cancer. Since December, have suffered incredible pain with a fractured hip. I'm on the waiting list for a hip replacement. I do have Māori heritage. I have not used it before, but hearing this news this morning, I will use it. It is totally racist.
And there were evidently plenty more messages where those came from. And at 6 a.m, Kate Hawkesby handed over to her husband, Mike Hosking, on News Talk ZB.
News Talk ZB.
Morning and welcome. Today, the new ethnicity score in health. If you are Maori, you get to the front of the queue. The Nats go after the game.
And it was only after that Te Whatu Ora's Dr Mike Shepherd told Mike Hosking Māori and Pacifica patients might only get 1 or 2 extra points out of 100 on that score because of their ethnicity. And clinical need was still the main driver.
OK, and adding the extra factors in, so 2 people, both 62, both with cardiovascular situations, one Maori, one isn't. The Maori one gets to the front of the queue, correct?
No, so it's not about getting to the front of the queue. I think what we're doing is, it's about adding some weightings, and it's about keeping an eye on the clinical prioritisation, because we know when people are on wait lists, we need to keep in contact with them and keep monitoring their symptoms, etc.
Yeah. But nonetheless, Mike Hosking said this in one of his characteristically strident editorials.
We are all equal, or the country is shot. And as we sit here, I think it's more shot than equal.
Now, after Mike Hosking on Monday, Kerry Woodham took over on ZB and devoted all 3 hours of her talkback show to that issue.
If they feel others have been prioritised over them because of race, whether it's true or not, that's going to make people extremely unhappy and dissatisfied, and in some cases angry.
And many getting in touch with her were, having been given that impression, even though being in the top-ranked ethnicity doesn't necessarily mean being at the front of the queue for surgery. And Woodham's second caller through that day seemed convinced that he was being pushed down the waiting list.
2 specialists in a clinic, which are the same race, but different race to me, I feel that I've been, I suppose, not looked after as good as some other people that I've heard have got their eyes done.
Interesting. Oh, see, that's what's going to happen. People are waiting a very, very long time.
Now there, Kerry Woodham didn't take the opportunity to clarify with that guy why he thought surgeons from another ethnic background might be shortchanging him because of his race. Now, while many callers were clearly exercised about what they saw as racism or favouritism, Kerry Woodham told listeners that she was trying to introduce a bit of equity on her show that day by reserving some talkback lines for Māori people to call in.
They've had historically low participation rates in talkback, so we'll keep 3 lines for No. You're all very welcome.
Just a joke, she insisted, but one that clearly some of her listeners didn't get.
Why 3 dedicated lines for Māori only? They have the same opportunity to pick up the phone and ring your show. Quite disappointed you've fallen into this trap. It was a joke! Anyway, maybe it's not that funny after all. Maybe this is the way of the future.
So, joke or not, in the end, it wasn't all that easy to tell. Now, on the same show, National's health spokesperson Dr Shane Reti was taking this more seriously, and he was choosing his words very carefully when telling Kerry Woodham how the Equity Adjuster score weights the 5 variables, something Kerry Woodham admitted she'd misunderstood.
Of course, I assumed that all the factors would be given equal weighting, but that's a very good point you make, that some of the factors might be taken more into consideration than others.
This is why I asked the question, and I even followed up with further questions saying, well, give me an example of someone in this situation. How would the ethnicity weighting apply?
But while the front page of Tuesday's Herald then reported that Dr Reti had slammed the policy as offensive and wrong, it also pointed to an explainer inside the paper. Now, this article was by the Herald's Nicholas Jones, and it was first published on the Herald's website the previous afternoon, and it explained that the issue which flared up after ZB's scoop was in fact nothing new. Auckland District Health Board used ethnicity prioritisation when working through waiting lists that had been swollen by COVID-19 disruption, Nicholas Jones explained, and he reported that former Chairman Pat Snedden had said back then it was a once-in-a-lifetime opportunity to reset an unfair system. And at the time, other DHBs followed suit, and Nicholas Jones didn't exactly bury the lead when he wrote all about it for the Herald at that time under the headline, which DHBs could prioritise Māori and Pacific patients. Now, that change was embedded in Te Whatu Ora a year ago, he explained, after a Health, Quality and Safety Commission investigation in 2019 had challenged health services to stamp out institutional racism, which, it said, severely harms and kills Māori. And Nicholas Jones also pointed to other research into health service inequities that had prompted the adoption of the Equity Adjuster Score in the first place, and that a government task force which had delivered a report on how backlogs could be cleared last year also backed Te Whatu Ora's approach.
Once high clinical priority cases have been addressed, priority must be given to excessively long waiting patients, with emphasis on the longest waiting Māori and Pacific patients. There are numerous examples of inequities in many planned care services. Initiatives must be put in place to resolve this.
And some initiatives that were also reported in the news at the time without controversy. For instance, in August last year, Whatu Ora Te Taukaro's interim director, Tracy Shebley, told Radio Wātea how they responded to what she said was a Health New Zealand mandate to catch up on the treatment of Māori and Pacifica patients who'd been sitting on waiting lists.
We've reviewed all our Māori and Pacific patients who have been waiting longer than 320 days in Te Tai Tokaro, and our team's now working really hard on scheduling those patients. This will mean that some patients will need to travel to other hospitals probably for surgery more than appointments, but in some cases we will be bringing clinical teams up here.
Newsroom's political editor Joe Moyer pointed out that up until February this year, ethnicity was only one of 2 factors deciding the waitlist in Auckland, and the Equity Adjuster Score formula was a response to surgeons' concerns that social deprivation and geographical location also needed to be included, as well as time spent waiting on the surgical lists, and that varies from medical service to medical service. And one of the new formula's creators, Duncan Bliss, told Joe Moyer that even so, clinical need always takes precedence and the Equity Adjuster Score doesn't interfere with that. Indeed, the Equity Adjuster Score is designed from a health perspective, he said, not a political one. Now, possibly with that in mind, at the Prime Minister's post-Cabinet press conference on Monday, Joe Moyer wondered whether that might not have been controversial at all in the first place if the criteria had been listed as just life expectancy rather than ethnicity. And she also wrote that Te Whatu Ora had tried to get Newsroom to remove the name of her source, Duncan Bliss, and instead attribute his comments to an approved spokesperson. And she wasn't pleased about that.
Experts involved in the design of our health system are exactly who journalists should be allowed to speak to. And the honest and refreshing comments from Bliss are exactly what those so incensed about ethnicity need to hear.
Indeed they are, and she was later able to tell her social media followers that Te Whatu Ora had called back to say that this was not handled appropriately and not the way they do things. Let's hope so. Well, on Tuesday, the chair of the Royal Australasian College of Surgeons said in a statement that the Equity Adjuster Score was not a zero-sum game, putting Māori and Pacific health above the health of other people in Aotearoa, New Zealand. And while the Herald turned all that into a story, Andrew McCormick was unavailable for further comment in the media, but only because he was doing his day job in Middlemore Hospital in a theatre operating all day. Now, the same day, Whakaata Māori Television's Will Trafford also pointed out that the policy appears to have been going until February without any incident, until now.
Today, partisan media and political spin doctors, the worst kind of doctors, have elected to land a few points in the lead-up to October's election.
Now, News Talk ZB and the Herald will take issue with Trafford's partisan media accusation there, doubtless reckoning that they've brought to light something of genuine public interest that was buried in bureaucracy until now. But Will Trafford pointed to 4 more major reports in the past 12 years detailing health disparities, and he said they showed why Māori waiting list prioritisation should have happened years ago. And with that in mind, it was apt that the day the story broke on News Talk ZB and in the Herald, the Waitangi Tribunal Health Services and Outcomes Inquiry hearings resumed again into claims concerning grievances relating to health services for Māori. And anyone watching the live stream of that would have heard there's been a long waiting list for those to be addressed as well.
The Y2109 Kāpō Māori claim was lodged by Mr. Mark Tibble some 15 years ago in August 2008. It was lodged out of a concern regarding the overall poor level of health, well-being and quality of life being experienced by Kāpō Māori and their whānau.
And there was not so much coverage of that in the news this past week, but as we've heard, plenty about the arguments between those who believe in a one-size-should-fit-all New Zealanders type of equality in health, butting up against those who say real equality requires equity, which interventions like the Equity Adjuster Score might just help deliver.